Atrial fibrillation is an irregular heartbeat. It's the most common arrhythmia experienced by the adult population. It affects about 10% of the population over the age of 75 and about 5% over the age of 65. Its incidence increases with age. The problem with atrial fibrillation is that it causes an irregular heartbeat that can precipitate heart muscle weakness or even strokes. People that are in atrial fibrillation need to be on some type of a medication to control their heart rate and a blood thinner to prevent them from having a stroke. Even with the medication and the blood thinner, however, people will still experience complications from the rhythm, and ideally, it's best to eliminate the rhythm. This is done initially by one of my colleagues, a cardiologist referred to as an electrophysiologist. They can evaluate the arrhythmia and ablate it. They put a catheter in through your leg to the inside of the heart and can see where the rhythm originates and either freeze or burn that area of the heart muscle tissue. Occasionally, people on atrial fibrillation will have no symptoms, but most people will have either palpitations, a fluttering in their chest, lightheadedness, dizziness. Some people will experience chest pain or symptoms consistent with heart failure, swelling of the legs or shortness of breath. Atrial fibrillation is a serious arrhythmia that affects a significant portion of our population. I would suggest that if somebody has atrial fibrillation or symptoms consistent with what they feel may be atrial fibrillation, be evaluated by your primary care physician or cardiologist and receive appropriate therapy. Oftentimes, their arrhythmia will respond to medical therapy alone, but if it does not, there's other options available, both through the cardiologist and surgically.